Hi, I'm Laura Mason, family nurse practitioner with Northstar Healthcare and Aesthetics. Let's see if you can guess what we're going to be talking about today. Say you're with a group of girlfriends and you're having a great time, you're laughing so hard, and all of a sudden you realize you have tears, not running down your cheeks, but down your legs. Or say that you're out jogging and you're about a mile away from any bathroom and you realize you have to go and you need to go now. I want to spend a few minutes talking about a very important women's health condition known as urinary incontinence. The International Incontinence Society defines urinary incontinence as the involuntary loss of urine, and that it can affect your hygiene as well as your social life. And it can start as early as in our 20s and go from there. There are two main types of urinary incontinence. One is stress incontinence, the other is urge incontinence. Stress incontinence is the involuntary loss of urine that occurs when we have pressure that's built up in the bladder, which increases during physical activity, such as yoga, jogging, coughing, sneezing, or laughing, and can happen after childbirth. The second type is urge incontinence, also known as overactive bladder or irritable bladder. This occurs when a special muscle which contracts the bladder is overactive. When it contracts, this muscle may make you feel like you've got to rush to the bathroom. What has been tried for these types of incontinences? Going to the bathroom every hour on the hour may seem like it's a bit trying. We all have busy schedules, busy lives, so maybe that might be not the best way to handle this. Another behavior management option would be to limit your water intake. This seems like a pretty risky thing to do. We don't want to become dehydrated and have what comes with that: headaches, fatigue, irritability. The third option may be Kegel exercises. Another option would be medications. Now, the type of medications that we use in the medical field are called anticholinergics. They work pretty well, but they're not without side effects. Dry mouth, constipation, blurred vision, may even bring on a little bit of confusion. Surgery may be appropriate for some women at the proper time and at the proper place, but it may not be the answer for everybody. So we do need to weigh the options here as far as what is feasible, what is not feasible. Let's talk about a non-surgical, non-medicated option for urinary incontinence. It's called the O-shot. What we do is we draw some blood and then we spin it down in a special centrifuge. We are using what's called the platelet-rich plasma. These platelets, when activated, release all kinds of growth factors which stimulate tissue repair, blood vessel formation, collagen, and nerve rejuvenation. The use of PRP has been around since the 1980s and has been used in orthopedic surgeries as well as back surgeries and in aesthetics and plastic surgeries. But now we know that we can use this in areas as sensitive as the bladder and in the vagina. So I'd really like you to consider using the O-shot for urinary incontinence. It has a success rate of greater than 85 to 90%, which is pretty exciting. Women need to have options. I think that this is a viable option using your own blood, no foreign products, with such a great track record for a variety of health concerns. If you would like more information on the O-shot and what we do at Northstar Healthcare and Aesthetics, please give us a call today.